everyone, to all those seeking vibrant health. Today, I just got back over the weekend to seminar and learned a little bit more about this crazy wild west of what's going on with CBD oils and hemp and things like that. And the last couple of years, it's been pretty wild and crazy of what's been going on with how many products have come on the market at least once a week or once a month. I have a patient approach me about, am I selling CBD oil and different oils like that. And I'm a big component, if you haven't paid attention to my thing about research and what is the best product and what exactly is this doing. And over the weekend I got some really good clarity on good research and taught some good research out there on this. And so I want to share that a little bit today, since it is the wild, wild west of hemp oil, it seems. First off, with any product, which I talk about, is you want to make sure it's a reliable source, it's healthy, it is non-GMO, hopefully organic. You want to get the best that you can of anything you put into your body, in my opinion. And so that's some of the really things you need to consider. Also, I'm a big component of whole food, whole products, parts of a plant or the whole, how it should be taken into, trying not to fragment it. So some research on some of the CBD that has been done is there is a CBD1 and CBD2, and CBD influences what they call the endocannabinoid system in the body, which is most recently discovered and researched most thoroughly in the last couple of years. I didn't even learn about it 15 years ago in chiropractic college and all my medical studies that I did, and a lot of doctors didn't start to learn about it until the last 2 years ago or so, is what it sounded like when we did a survey of the audience in there. So the more of the people that are more recent or students still started to learn about this. So it is actually a system in our body. We have cannabinoids receptors, and it is receptors that are in different parts of our body. We have some in our brain, our pancreas, our lungs, and all different places in our body. And these receptors need to be, there's a CBD1 and CBD2, and they have to be in a certain ratio, and how it presents in nature is like more of like a good balance in nature. So when we start to mess with things in nature, then we start to have side effects, and that's what some of the research of more of like medical marijuana or medical things, when they started skewing some of these ratios, trying to get like some maybe food suppressing or appetite suppressing parts or things like that, they started having psychotropic reactions and things like that. Because anytime, in my opinion, we start to mess with how nature creates things, we start to kind of mess it up. So, I mean, you guys do the research yourself on that, but that's the trend I tend to see. But now they have saying, if you have good product, and then we're not talking about the famous THC, which is like, that's what gets people high. We're talking about the part of the plant that has low THC, but has more of these CBD, these cannabinoids, which are the ones that help the receptors do all these medicinal things. And so it's pretty awesome, the things that they can do. There's global, they help decrease inflammation. So a lot of people, I've had some testimonies of patients coming in, it's helped their joint pains and things like that go away. Some chronic inflammation patients, it's helped with that. I have had some patients say it has helped with sugar handling in their diabetes, because that diabetes sometimes is inflammation of the pancreas. It helps with maintaining, decreasing stress levels and homeostasis in the body. There's a lot of good benefits, but again, in a proper dosage, not overdoing it, and also it helps because the plant itself is more gritty. The stalks and the seeds is where actually a lot of the benefits are in, not the bud or the plant, and our blend or whatever, that part. And so that's all of the stuff I've learned this weekend. So it's pretty awesome. Make sure it is a more fat soluble for it to be digested or absorbed more readily. And those are kind of the things there. So I do have some things that I've been looking into on that. If you're a patient, you can ask me questions on that. But you got to make sure things are right for you everything you do, take herbal or otherwise, you should make sure that it is a best match for your body and it's actually would be beneficial to you. Not just because if it is natural and healthy, it doesn't mean it's naturally unhealthy for you. I've talked about this in my past talks. I think I did when I talked about the herbs down Christmas time, the 3 gifts. I talked a little bit about herbs then. I have patients that are sensitive to frankincense. I have patients that are sensitive to golden seal and things like that. So we have people that I've broken up in hives because their body is just not compatible with some of the herbs. So don't just go out and do things, and especially don't do high doses of things if it's not appropriate, or make sure your body is good with it. So you should always get some professional recommendations and advice anytime you're doing something to try to help your health. Us wellness chiropractors, and there's functional medicine and other people, herbalists, things like that are out there to better help you see what works best for you. So I hope this helps some of your confusion out there. And if you have any comments below or questions below about this particular topic, go ahead and comment below. That would be great. The one little thing too I did forget to talk about is CBD itself is labeled as a drug, so that that is not, shouldn't be how it should be labeled, because that could be then saying it's a drug. Hemp is how I'm talking about it, because that's the whole plant and things you can digest. So take care. I hope you all have a great night, and have a great healthy week. Take care. Bye.